Now, when you're going to open a center like this, you spend a lot of time thinking about the costs and the advantages and disadvantages to a fixed C-arm versus a mobile C-arm. And I'm just going to go through some of the preconceptions I think a lot of people have. So the fixed C-arm, the advantages or the perceived advantages would be good resolution, high heat capacity. There's a large image intensifier. The table floats well. The excursion on the table is far. And traditionally, that's, I think, what people considered the best system. There's disadvantages. It's very expensive. The installation is very expensive. That's like $250,000. And if you have a problem with a room, or say you're going to move your office in 5 years, you have an 8-year lease, well, you can't really move it unless you're going to spend several $100,000 to move it. And it's not doesn't have the ability to configure like the one I'm going to show you here in a minute. And so, for instance, when I go to the hospital, there's lots of procedures that, although a few are very convenient, some of them are extremely awkward, and there's really no way to turn the table or turn the monitors, and you end up in these awkward positions. So what are some of the advantages of a mobile C-arm? It's less expensive. We now have substantial size image intensifiers. In Florida, we don't need any room preparation. You just roll the machine in the room. In fact, my first room was our old vein room, and we were waiting for our new office to be built, and we just pushed the machine in the room, and we called it the Murphy bed, and she was sweet. I don't know if you guys know what Murphy beds are. Those are the ones you pull down the wall. So it was just a little tiny room that we shoved our C-arm in. It's easy to replace. You roll the machine in and out, and there's unlimited room configurations. I'll go over that in a minute. Now, initially, we only had a motorized C-arm with GE, but now you guys will be having your motorized C-arm, which is more advanced than theirs is. And now there's two companies with flat panel, the Philips and of course, the C-Amm. Possible perceived disadvantages to a mobile C-arm would be that it has less heat capacity. I've never had a problem with the C-Amm. It doesn't penetrate as well in some of the heavier patients. It doesn't have the resolution of a fixed room, but of course when you have a machine like the Z-Amm with a flat panel, it has exceptional resolution, which I think is really, in my mind, makes it a lot better than even the current GE, even though we don't have the motorized unit. You're going to battle sometimes perception by some traditional interventional radiologists about not having a fixed room, because that's what I was trained on. Surgeons are more used to using C-arms in the OR. And cardiologists, I think, are probably somewhere in between. There's a table that's not matched like it is with the fixed room. So I think it's important that when you're selling your machine, you also have a lot of options on tables to make the decision not too difficult. And I think some of the advantages of the Z-Amm RFD is that the resolution is exceptional. And so when I was making a decision on the machine I wanted, that really blew out all the other, that was like number 1 through 10, because I figured whatever issues I was going to have with the machine would ultimately be resolved, and the resolution was the most important. And in fact, there's been a whole number of updated software programs, and so any issues we had were rapidly changed. I think that's one thing that a company like Z-Amm has, unlike GE, which is a gigantic elephant that takes a lot of time to change any kind of problem.